My name is Jackson Richey, and I'll be presenting the impact of COVID-19 on the implementation of evidence-based practices for substance use among community mental health centers in Indiana. The Amplifying Community Capacity for Evidence-Supported Services, also known as the ACCESS study, seeks to provide support in the form of continued education for community mental health centers to effectively use the evidence-based practices of motivational enhancement therapy combined with cognitive behavioral therapy as a method for effectively screening and treating substance use disorders across the state of Indiana. Motivational enhancement therapy has been recognized as a useful evidence-based practice for substance use disorder, especially when paired with cognitive behavioral therapy. Therefore, our team hopes to implement and sustain an evidence-based approach to assessments and treatments of substance use disorders in adults and youth across the state of Indiana, while also increasing clinician confidence in their MET/CBT skills. So what we have found thus far is that in the middle stages of COVID-19 compared to early on when we were starting to do the Zoom group calls for training, we have had an inconsistent participation. The quality of cases brought to calls has declined significantly during the implementation of the COVID restrictions. The MET/CBT skills that were taught at baseline have never really reached their full potential since the impact of COVID. All in all, we believe that it's on the mend and anticipate it to improve until the end of funding this year, which will be in September. So as the CMHCs have adapted to the COVID-19 limitations, we've seen that upward trend in all data points for the last 2 months, and we do anticipate this to continue. We also seek to continue the improvement of overall clinical unity across the community mental health centers. We also want to increase the clinician confidence in their MET/CBT skills and get that to where we think it should be. And then we would also like to identify new and cost-effective methods of engaging the CMHC therapist, as that has proved to also be a challenge for us. Thanks.